As a therapist educator, I have heard from many therapists that the usual grounding techniques and breathing exercises aren't effective for some of your clients. That for these clients, any invitation to connect to their bodies results in blankness or dysregulation, and that breathing exercises result in an increase in anxiety. Now, if this has been your experience, I want you to know that you're not alone. I've had my own struggles too. I'm Linda Tai, an educator, international speaker, and mental health clinician who teaches therapists to comprehensively understand the nervous system so that you can help your clients heal from trauma and attachment wounds more quickly and effectively. Before I became a therapist, I was invited to teach mindfulness in an addiction recovery program. I was so psyched, having taught meditation into the general community for 3 years. And there I was, expecting calm and focus, but instead I saw folks looking out the window, dissociating, or their bodies trembling with anxiety, and some folks were falling asleep. There was one woman in early recovery, in withdrawal from benzodiazepine addiction. When we did mindfulness practice, her body became more jittery, her anxiety skyrocketed. She did not have the capacity for non-judgmental, present moment awareness. And those calming breathing exercises that are supposed to calm you down, they also increased her anxiety. I then turned to grounding techniques. And how many times do we tell our clients to feel their feet on the ground, feel the back of the chair, to notice the rise and the fall of the breath? And it worked, sort of, for some people. And I also noticed that folks were white-knuckling through meditation class, and I wanted more for them. This led me to a critical realization. In trying to help, I was overlooking something vital, the impact of trauma on an individual's nervous system and sensory systems. Despite my tools and techniques, I was missing a deeper understanding of trauma's impact on these systems. And so I embarked on a comprehensive learning journey, completing trainings in brain spotting, IFS, TIST, Polyvagal theory, sensorimotor psychotherapy, somatic experiencing, flash technique, having, and more. But something still felt incomplete. I realized I needed a profound understanding of the nervous system that incorporates trauma, the missing experiences of development, sensory processing, and neurodiversity. And truth be told, I was desperate to heal my own pain. I was a child refugee from communist Vietnam who grew up in Australia, and my parents did the best that they could in extremely difficult circumstances. But we were cut off from land, community, ancestors, and traditions. All of the trainings that I'd done in these psychotherapy techniques focused on the parent-child relationship and the individual trauma and ignored the larger context. And none of them gave me a full picture of the nervous system. I am truly grateful for what I've learned in each of these trainings. You see, each of these trainings provided a piece of the puzzle, but it was only as I put those pieces together that I was able to heal myself and my clients. I worked with a client with DID who had a history of sexual abuse and engaged in self-harm. Because of what I understand about the nervous system, I knew that we needed to resource each of their parts in a different way, so that the gains that we made in therapy could be integrated across their entire system. Specifically, in order to engage in trauma reprocessing for their self-harming part, their young attached parts needed a stuffy to squeeze from time to time. Their two fight parts needed to be given permission to complete their fight responses by snarling like this. You see, young attached parts, they don't like lots of nervous system activation. So when this nervous system activation does happen, then typically the fight parts turn up to protect the young attached parts. The fight part says, "Don't worry, I got this. I'll handle this one." And then runs away with the high sympathetic nervous system activation. But when this happens in therapy, we can't work with the self-harming part. We actually need to get all these parts on board and resourced in order to be able to do this hard trauma work. And since I was getting such great results with my clients, I started sharing my approach with other therapists. And the feedback I've received has been inspiring. Students have called it groundbreaking, noticing substantial improvements in their clinical outcomes. One student said, This has completely transformed the way I operate as a therapist. It's actually making my job easier and making me more effective when working with my clients. And so to bring this to more therapists, I've developed a comprehensive course with the Academy of Therapy Wisdom. This course is about piecing together a complete map of the autonomic nervous system, tailored for those tricky spots that we encounter in therapy. And in this course, we'll delve into more than just upregulation and downregulation. You will have a broad range of techniques for providing safety and stabilisation. We need to have low-hanging fruit that we can offer to our clients to help them feel better right away in the moment. This then builds trust and empowers the client to know that they can develop the skills to feel better. And we will look at the nervous system from a bunch of different angles. We'll learn how to identify, understand, depathologize, and work with distinct autonomic nervous system states, like I did with my DID client. You'll learn how to navigate through the complex interplay of trauma, sensory processing, and neurodivergence. For example, is it sensory meltdown or is it a trauma reaction? Is it sensory burnout, autistic burnout, or depression or collapse? Is it ADHD, rejection sensitivity, or CPTSD, abandonment trauma? We'll dive into somatic transference and countertransference. Does it ever feel like a client is subconsciously trying to make you angry, to get you to rescue them, or to get you angry on their behalf? I'll offer compassion and understanding for these baffling interrelational dynamics and how they tell us exactly what we need to do to help them heal. We'll broaden your perspective on attachment theory, moving beyond traditional dyadic relationships to include bonds with nature, culture, and more. Join us and revolutionise the way you approach trauma therapy, and let's embark on this transformative journey together. I can't wait to share with you all of this awesomeness that makes trauma therapy